following video discusses art therapy interventions and treatment. While origami may be an effective coping skill without the aid of a therapist, these videos are designed to work alongside therapy and are not in themselves a form of treatment. If you are experiencing mental health symptoms, please contact a local mental health care provider. This training will not qualify you as an art therapist. You can learn more about art therapy at arttherapy.org.
Hello, my name is Kamri Hosmann. I'm currently pursuing a master's degree in art therapy counseling, as well as a master's in clinical psychology at Emporia State University. The following videos were created as a part of my master's project in partial fulfillment for the requirements of my art therapy degree. This project is a series of video tutorials for mindfulness-based origami as a tool for clinicians. By accessing these videos, art therapists and other professionals will be able to teach themselves the origami and mindfulness skills to become teachers for their clients. These videos can also be viewed together by clinician and client during the session. Or, because the videos are made publicly available, the tutorial portion of these videos can be assigned as homework for the client to experience outside of the session. This is the first in a series of 5 videos. In this video, I'll be discussing mindfulness and origami and exploring how to effectively combine these interventions to improve engagement and build rapport in the therapeutic setting, while also providing therapeutic benefits to clients. I'll also be discussing materials needed, population considerations, and some common adaptations. So let's begin with mindfulness. Rappaport and Kalmanowitz define mindfulness as a practice of bringing awareness to the present moment with an attitude of acceptance and non-judgment. The 5 universal factors of mindfulness are awareness of inner experience without reactivity, observing and noticing perceptions, thoughts, and feelings, acting with attention and concentration, describing and labeling with words, and non-judging experience. Flow is defined as a state of being fully immersed in a process and is characterized by intense focus, a merging of action and awareness, an increased sense of control, the phenomenological sense of timelessness, and a feeling upon completion that the process itself was intrinsically rewarding. Mindfulness and flow are sort of interconnected in that you can't have a non-mindful flow experience because both are categorized by becoming attuned to and present with a deeper sense of connection and enjoyment. I like to think of flow as sort of an active meditation. You can't really get to a flow experience by sitting quietly the way you can with mindfulness. You have to be engaging in something that's somewhat challenging and requires your focus. Origami is a good way to foster a flow experience and reap the benefits of mindfulness practice. It's especially helpful for people who struggle with more passive mindfulness exercises like mindfulness meditation or focused breathing. Mindfulness-Based Art Therapy, or MBAT, which is a modality that combines art therapy interventions with complementary mindfulness exercises, has been shown to be very effective at reducing anxiety and stress and promoting mindfulness without feeling difficult or threatening to those who participated. Origami was used as an art therapy intervention in an MBAT protocol by Edwards and Hegarty in 2016. Who noted that participants showed an improvement in relaxation, motivation, and comfort in the therapeutic setting, as well as an improvement in mindfulness, engagement, and self-esteem. So let's talk about origami. I want to begin by briefly discussing the history of origami. A lot of people believe that it's solely a Japanese art, but that's not completely accurate. So paper folding itself may have originated in China, where paper was invented. But paper folding traditions developed globally with notable variations in Spain, England, Germany, China, and obviously Japan. The currently accepted tradition of origami, which utilizes square paper that's folded and never cut, was actually developed in Germany and introduced to Japan in about 1880. At that time, Japan's schools were taking on a slightly more German format, and this included integrating origami as a learning tool. Origami actually has a long history of being used in education around the world to teach geometric problem solving, and teachers who have used it have noted that it promoted increased engagement with the course material in the classroom. Therapists too have been using origami for many years due to that same sense of engagement, as well as many other benefits associated with the use of origami in treatment. The literature on origami shows that it has been effectively used in the therapeutic setting to improve concentration, manual dexterity, self-esteem, and socialization. Origami has also been shown beneficial for memory care, feelings of control, and frustration tolerance. It's been used in a wide variety of populations and is cited as beneficial for clients with trauma history due to the feelings of control that paper folding can encourage. It's also noted as ideal for clients in a restrictive setting like hospitals or jails, as it only requires paper, which is typically available to clients without issue. Let's discuss some of the materials that you'll need to make the origami models that you'll be learning in the later videos. Please feel free to work along with me as we go through those tutorials. So first, a couple of optional things. You'll need scissors if your paper is not already cut to square. Something you may also choose to use is a bone folder. This can help you get really crisp folds and may be easier for clients who have difficulty with motor coordination or a limited range of motion in the hands. I do want to note that while it's called a bone folder, these are typically made of Teflon these days, which is a synthetic material. So if you're vegan or have vegan clients, it's not actually bone if that was a concern. They're pretty cheap and you can get them just about anywhere you get craft supplies. The most important material is paper, and the type of paper you use matters. That said, there's some flexibility in what paper you choose to use. Magazine paper is the first option. It's pretty soft, flexible, and forgiving, but that flexibility can also mean that it's a little bit unruly, which can sometimes be frustrating, especially for more difficult models. You wouldn't want to use magazine paper for anything that gets creased over and over, like the dragon model, but it's really great for simple models that don't require a lot of intricate or small folds. Notebook paper. This paper is really thin. It takes creases well and it bends easily, but it's also not ideal for more complex models because it doesn't really hold up to too many folds and maintain its stiffness. What I like about notebook paper is that it looks really crisp, even if you have to recrease the page, so you can move the creases relatively easily as you work through the model. That means it's a pretty good paper for beginners as you're just trying to get down the basic folds of the model. Printer paper, this is actually my favorite paper to use. It's thick, holds its creases strongly and maintains its stiffness, but it's not very forgiving. The folds need to be straight to get a good result, but it tends to be the best paper for me when folding more complex models because it does hold that stiffness. And finally, origami paper. So this paper is beautiful, but it's also very thin and it's not very forgiving. It can be a little bit expensive as well. What I suggest is working up to this paper and waiting to use the origami paper until you're really confident in your ability to fold the model with precision. One thing that I like to encourage is to decorate your own paper. You can write on notebook paper before you fold it. You can maybe use that poem that you didn't know what to do with, fold an A+ test to keep it on your desk. Use a coloring page you did or some old doodles. You can really turn a lot of good old art into new origami models if you're so inclined. One of my favorite things to do is to intentionally decorate my paper before I fold. I suggest using markers or pens because graphite or colored pencils and crayons can smudge when you're doing the folding and can get on your hands, which I find really unpleasant. If it doesn't bother you, you can go for it, but it's just not my favorite. For the tutorials, I'm going to be using these. So if you find that you or your client struggle with processing visual or spatial information, it might benefit you to code your paper in a similar way while you learn the models. In speaking of clients, we touched on populations a little bit, but I want to return to that point. In the conclusion video, number 5, I'm going to talk a lot more about clients you may not want to use origami with, or you'll have to be careful in considering before you bring it to. But right now I want to talk about how we can be a little bit more inclusive in our origami use. The literature notes that origami has been taught across language barriers to deaf individuals, visually impaired or blind individuals, and people with physical impairments. There are even people who have learned to fold origami completely with their feet. For the purpose of these videos, I want to discuss a couple of techniques that can be used really with anyone to make the process a little easier to bring to clients who maybe have a little bit of trouble with that manual dexterity. So the first technique I want to discuss is hand over hand. This is a technique we use in art therapy. If a client needs help with the steps of the process, you might, with permission, help guide their hands through it, actually kind of assisting with that dexterity manually. You might also lend what we call a third hand. So holding the paper so a client can crease it, or helping to line up a fold for a client who's having difficulty. You might just hold the paper in place and allow the client to do whatever they're capable of. What we don't want to do is just fold it for them. We really want the client to be doing as much as they can and helping to really increase that participation as much as possible so that they're able to reap as many of the benefits of the process as they can. So I hope you'll keep that in mind as we move into the tutorials in the next few videos, and I will see you there.